Hi, my name is Brian Britt. I am a board certified orthopedic physical therapist, and today I want to talk to you about something I hear quite a few of my patients talk about, which is why won't my doctor give me an MRI, or why will insurance not approve me for an MRI outright? Again, it doesn't make any intuitive sense. You have musculoskeletal pain, pain in your back, in your knee, in your hip, shoulder, whatever, but they're holding off on getting testing. Why would you want to wait to get testing to see what's going on, what's going wrong? And the reason I see this as a physical therapist is oftentimes the next course of action is, well, let's try 6 to 8 weeks of physical therapy. And the patient's already coming. They said, well, I don't understand, Brian. Why won't they give me an MRI? What's the hang up? Why won't you just give me the testing I need? I'll pay for it. I don't care. What is the danger in me getting an MRI? And the short answer is there is no danger, but your doctors and the insurance companies are actually right. There's no benefit in getting an MRI if there's no immediate risk to life or limb. And your healthcare providers are pretty well trained to decide what is an immediate risk and what isn't. And my hope is you come out of this with a better understanding of the process of how to diagnose and correctly treat musculoskeletal conditions. I think the best way to really explain this is to go back to a time far, far away, the 1990s. And in the 1990s, a lot of hospital systems were getting a brand new machine, and that was the MRI machine. They wanted to use it. They wanted to use it so they could help patients just like you get better. And so we went about this for a number of years. We had this brand new tool, and when we saw a problem, say a disc problem in your back or a torn meniscus, we immediately went to surgery. And again, we went on this for a while. We thought we were doing a great job. And then some very intelligent researchers decided to look back and say, how good of a job are we doing? And their results were pretty shocking. Not only were we not doing a good job, we were doing worse than we had been before. So what happened here? Why did we suddenly have worse outcomes? How come we weren't treating patients better? And I think it all comes down to we were taking a very patho-anatomical approach, meaning we were looking pathology in tissue and we were fixing that pathology. But musculoskeletal conditions are complicated and they're messy. Not only do we have to think about the anatomy that is impacted by this, we also have to think about the function. And on top of that, we have to think about other variables like your lifestyle and your habits and your psychology. It can get very complicated very quick. So MRI gives us one thing, and it gives us a picture. Picture doesn't always tell us the best way to treat an individual. It doesn't light up red where there's pain or show us where somebody's having more tightness in one muscle or weakness in another muscle. That takes a more nuanced approach. Furthermore, there have been other studies that have shown that for a variety of conditions, they're actually more common than we ever thought. We take healthy volunteers, people without pain, and we put them through an MRI machine, and we'll find all sorts of things. We'll find labral tears in people with no shoulder pain, disc problems in the back where people have no real functional loss, pain, or anything else. So again, what makes the most sense in the light of the information that we have? What makes most sense is to take a conservative approach. And the conservative approach involves physical therapy first. We go to physical therapy for 6 to 8 weeks because we want to see if fixing these functional issues, optimizing this person, is going to fix that problem. Or are we going to be able to make improvements with this and then move on to the next step? The third case is, do we want to go ahead and get that MRI? Now, an MRI doesn't tell a physical therapist much about how to treat their patients. We can see how you move. We can test your muscle strength. We can see those things. We're not here to make any cuts. However, an MRI machine is very effective in guiding a surgeon's scalpel. So Again, oftentimes when we're doing an MRI, we're often thinking that surgery is going to be the final outcome. I hope this has helped you understand better why healthcare providers are making decisions that they are. They're doing it so that they can help save you money, and they can help save you time, and they can help save you the pain of having to go through a surgery. They're also trying to make sure that this surgery may not ultimately be unnecessary. And in many cases, these things can be improved through conservative treatment. I hope this helped you find your meaning in movement.